We are, and Marcy asked me to talk to you a little bit about our intake process in addition to the report that you have from us for this month. All right, there we go. So Marcy just wanted me to take a few minutes and talk to you about how a person comes to the Department on Aging and are able to seek services. So I'm Jennifer Guthrie. I'm the in-home services coordinator through Department on Aging. So all of the referrals for new services for in-home come through me. All of our services are based on our mission to help seniors live full, active, and independent lives. To do this, we are part of the Jackson County Board of Commissioners strategic priorities through Healthy Communities. And we have two components. We have a component for our more active seniors through our nutrition sites and enrichment programs. And then we also have our in-home services for seniors who are more homebound and need more service to remain in their home environment. Fees are not charged for our service if the person's income is 150% of poverty or below. We do ask for a fair share donation. That's part of our Older Americans Act funding requirement. How much they want to donate back for their service. Part of our determine what needs are there, what areas their functioning could be improve that level of functioning and help them to remain in their home environment for services through our agency and other community agencies. From different resources. Most of our calls come from the senior themselves. Field physicians, hospitals, home health agencies, and then finally other the information we need to determine whether or not they meet the eligibility requirements. So we can usually finish that call in 20 to 30. Worker who will then go out and meet with the senior in their home to get so across the state, all departments on aging so we do that assessment at the initial contact with the other services. We prioritize services criteria such as income, their functional health, handicap level, and social need. So we're looking at a variety of overall need is, and then services are prioritized based on those needs. Take the referrals that were agreed upon in the home visit and make sure that we have everything documented for our grant auditors. In 2016, we serviced 1,022 seniors in Jackson County through our case coordination and support. 679 of those were caregivers that were caring for someone 60 years of age or older in need of service, or the caregiver themselves was 60 years of age or older. And we accepted 995 intakes during that year. We get lots of nice compliments, which makes makes coming to work even more wonderful. Like, thank you very much, you're so kind, so helpful. Our favorite one is, you helped me to be able to stay in my home. Any questions? Okay.
Yes, Jennifer? Chairman?
And I don't know if you can answer this or not, Jennifer, but on Friday with the extreme weather conditions, Meals on Wheels did not deliver its home meal.
Right.
That would have been a weekend delivery also. Mm-hmm. How do you help those people? Do you go on Saturday? I'm just trying to understand, and I know Marcy's explained it in the past, but I don't remember the explanation.
And I can explain it, thank goodness.
Okay.
What we do is in the fall, usually the last part of October, we put together what we call emergency meals, and they're shelf-stable meals, and there are 2 of them in each delivery, and we There is a snow day. The gauge that wieners at that time, that's the day that you eat your emergency meals. We also plan ahead for things like Fridays, and we deliver our weekend meals on Thursdays. That way, if it's a snow day Thursday, chances are it probably will not be on Friday, because Jackson Public Schools, it takes a lot to close them. So we'll be able to deliver our weekend meals then on Friday. But if it's a snow day on Friday, they already received them on Thursday. So the seniors on Friday had already received their weekend meals, and we had already had 2 snow days in the year, so we had already replaced those emergency meals as well, so they had 2 frozen meals in their freezers to use for Friday.
I had constituents call me who were concerned about relatives or the little old lady down the street who they know gets the meals, and because at the time there was rumors going around that Jackson County was closing and everything like that, and I know that we didn't close on Friday as a rule, but Meals on Wheels then has prepped in advance. Good.
Yes.
I can answer those questions for people now. That's very helpful. Thank you.
Thank you. In addition to that, we also, when our social workers go out, we also prioritize the seniors based on how much support they have in the community. So we have what we call a priority one list. If there is more than one snow day in a row where we know they're going to run out of emergency meals, we contact everybody on that priority one list, and our staff will actually do a special Meals on Wheels route for those folks. Whatever it takes.
Okay. Thank you, Mr. Chairman. Any other questions?
With me today, I have Victoria Harper, and she is a student intern from Spring Arbor University that's coming to learn all about social work through the Department on Aging. So we're very pleased to have her. She's been a great asset, a good fit.
All right, good, welcome. Thanks, Jennifer, and appreciate the explanation, and
Thank
that
you.
was a good question. Thank you. Okay, we're down to number D, the Health Department. Richard.
Yeah, you got 2 hours, Richard, let's go.
Thank you, sir. Good afternoon to all. I don't think I got 2 hours worth of stuff here, but you get me started, I might never stop. My report is in board docs, obviously. A few things I wanted to highlight and kind of give you some updates on as well. We're kind of always having a focus on how we would execute the function of transporting antivirals or medications, if you will, that might be needed in the community for emergencies. So we do this every so often. It's actually part of an annual work plan that we agree to with the Michigan Department of Health and Human Services. So I just want you to know that we're always engaging in one way or another around this issue. I'm a member of the Financial Stability Network here in the community. This Financial Stability Network is organized well over a year ago at this point in time, and it really came out of a lot of conversations that took place at the local level in the Health Improvement Organization and Cradle to Career, which is our education network in the community. And we all have recognized the really strong relationship between financial stability and health status and health outcomes as well as education. So that's in a really small nutshell why this particular network was organized. So it has 3 active action committees. One of them focuses on housing. That's the one I participate in because we're always concerned about the safety and affordability of housing as well as health issues that can come up in housing. So recently, the Community Action Agency, who co-chairs the particular Coordinating Council for Financial Stability and also is a member of the Housing Committee, did write a letter to the city of Jackson concerning their CDBG home action plan, looking for a little more sharing of resources, if you will, to directly support some of the people with housing needs in the community. So I just wanted to share with you that a lot of work goes on behind the scenes sometimes that you might not be aware of, and Community Action Agency's letter that was sent is part of the packet today. We were very pleased to have Commissioner Williams join us at the Health Department for an orientation. We did not get you everywhere in the building either. We think we needed a good 2 hours, and I think we only had 90 minutes. But anyway, I hope that it was helpful and useful for you, and if you have any questions about any of the material that we shared with you, please feel free to get back in touch with me. Thank you. You may have heard something either through Lifeways or if you sit on the MDHHS local board about the MDHHS referral and access partner site through MyBridges. It is going to be activated with a soft launch in February this month here in Jackson County, and it comes off a pilot test that was done in Muskegon County last year. So the Health Department is actually registered as a referral and access partner on this particular site, and what it means is that when people go to MyBridges to apply for health insurance or food stamps or transportation assistance, housing assistance, whatever they might need, they also will have an opportunity to voluntarily indicate in the system if they need help with other things. And depending on what those other things are, any of the social service agencies and health agencies in the community who are registered with the site and in the 211 database can receive a referral from MyBridges to follow up with that particular individual and see if we can help them out. In a nutshell, that's kind of what it's about. It's similar to the social service navigation platform we're developing locally here with the SIM project as well. I provide you with a drug overdose deaths update, if you will. You'll see that most of the data in this particular portion of my report comes from CDC's National Center for Health Statistics. And pretty much what I can tell you is that just being a comparison between our data here in Jackson County and the national level data, we're pretty close and very much the same in many respects. The same drug overdose deaths, highest among adults aged 25 to 54, is pretty much what we're seeing in this county as well. And we probably had over 60 cases, I believe, in calendar year 2017. So we're still higher than what we'd like to be and want to kind of do more work to push that down. I did mention that Michigan is statistically higher than the U.S. overall rate. And in terms of trying to help us understand a little bit more on what's going on, say at the state level, to try to help address this from a legislative perspective, I did attach a copy of the Michigan Health and Hospital Association memo to all of their chief medical officers, their hospital CEOs, et cetera. And it's a good, kind of a nice summary of all the various laws that were passed in 2017 trying to deal with the opioid problem, everything from parental consent for opioid prescription, to prescribing limits, to post-overdose patient education, to the Michigan Assista MAPS, which is the Michigan, I'm not sure what the A stands for, but it's a prescription system that every provider can go into and actually check to see if an individual patient has already been prescribed an opiate drug someplace else from another provider in the community or the state, if you will. So that's really good. They're now requiring licensed providers to obtain and review that MAPS report. Now, previously it was a voluntary participation system, but if they're prescribing more than 3 days, they have to pull a report from MAPS and verify. The requirements as well associated with all this legislation. So I'm still waiting for some of the backbone support staff for the drug summit to pull that together. April 17th in Lansing, and wanted to share that with you. I don't have the week, that is, but we're always interested in having you attend. Teen pregnancy prevention update. The final teen pregnancy rates for just a Southeast Michigan outbreak. As you can see, I provided quite a bit of data there. The hepatitis A associated with this outbreak. You can see that we've had and rather significant, I think, for hepatitis A. You don't usually see it, but I think CDC has approved the state of Michigan reaching out even beyond the outbreak counties, and we, within our available resources, they're not giving us more vaccination. Army and the Victory Clinic are three good examples of how we're reaching out and determine whether they're eligible for the vaccine that we do have. So we have that going on right now. Report
Richard?
is, yes.
I'd like to give thanks from the Interfaith Shelter staff at-risk people because of being involved with the indigent population and
We have had 4 outbreaks of influenza in long-term care facilities or very difficult illness to also have at the same time that influenza is making its way around your and as far as I know, that is still in effect here in Jackson as well. Time. We're continuing to communicate the message to everybody that we can that there are 3 other strains that are part of the vaccine. There's 2 by the vaccine still today from the other strains, and probably at a much higher rate right now.
For taking me through. It was very informative. It had been a bit since I'd been out to the health department. I don't think program, both for our dealers here in town, certainly for the
Really much appreciate you kind of bringing that up in some discussion and conversation with us either. And we're going to follow up with you on that. Thank you.
support.
Okay, a motion of support to send the claims to the full board. All those in favor, signal by saying aye. There is no other minutes. I did look again. F, MSU extension. Public comment, back to public comment. Anybody? Oh, the chair wants, go ahead.
and convalescing well. So that's good news.
Good.